Okay, I hope you hear me now. Okay, hello, my name is Achim Burger. I'm from the cardiology department of the Klinik Ottakring in Vienna, and I'm very pleased to present the case of a patient with acute myocarditis a few days after vaccination against COVID-19 with an mRNA vaccine. So this is the case of a 36-year-old male patient. His previous medical history included an arterial hypertension. He was an active smoker with approximately 20 pack years, and he had a positive family history for cardiovascular disease with both of his parents suffering from premature myocardial infarction. And approximately 48 hours prior to hospitalization, this patient received the second dose of his mRNA vaccination against COVID-19, and he presented at our emergency department with acute chest pain since the day of admission. So here we see on the left side the initial vital parameters of this patient. We see that the blood pressure was slightly elevated with 150 to 80, but with a normal heart rate, a normal respiratory rate, with a good oxygenation without additional oxygen supply. However, his body temperature was slightly elevated. And on the right side, we see the initial ECG. We see that this patient was in a normal sinus rhythm with normal heart rate. However, we see that the ST segments in the inferior leads were slightly elevated. So this patient was further referred to coronary angiography. And here we should see the right coronary artery. And here we see a large vessel, the large right coronary artery. We see that it's unremarkable without any significant stenosis. And also on the left coronary artery, we see an unremarkable vessel here with a small ramus circumflexus, but we don't see any significant coronary artery disease in this patient. So let's have a look at the blood work of this patient. We do see that this patient did have a significant elevation of cardiac enzymes. We see that the high sensitivity troponin reached its peak on day 1 after hospital admission with a continuous decline in further testing. And this patient was then further evaluated with cardiac MRI, demonstrating that this patient had a normal left ventricular ejection fraction and an unremarkable myocardium in the T1 and T2 sequences. However, in the late gadolinium enhancements, we saw that this patient did have significant late gadolinium enhancement in the apex of the heart, the left lateral free wall, as well as anterior and inferior, very much compatible with the pattern of acute myocarditis. And this association between acute myocarditis and the mRNA vaccines is previously described in several reports. And in this context of this topic, 2 very interesting studies from Israel were published very recently. And this is the first study that used data from a large national health service in Israel. They included data from more than 2.5 million patients that received the BioNTech Pfizer mRNA vaccine. And they assessed the incidence rate of acute myocarditis within 6 weeks after the first dose of the vaccine. And here we see the primary result of the study. We see that the overall incidence rate of acute myocarditis is quite low in the overall study population with 2.13 per 100,000 patients. However, very interestingly, we see a remarkably higher incidence rate among male patients compared to female patients, and we see a remarkably higher incidence rate among young patients between 16 and 29 years old compared to patients with 30 years or older. If you look at the clinical severity of the disease on the right side, we see that the most cases were mild and no fulminant myocarditis. And here on this figure, we see the cumulative incidence rate of myocarditis within the 6 weeks since the first dose of the vaccine. And very interestingly, we see that the incidence rate rises more steeply after the second dose of the vaccine. Another very interesting study was published approximately at the same time. They used data from the Israel Ministry of Health of the active surveillance program of the COVID-19 vaccines, and they assessed the incidence rate of acute myocarditis within 6 months after the first dose of the BioNTech Pfizer vaccines, and they included a total of more than 5 million patients. And here we see the results of the study. We see comparable results to the previous study. We see that the overall incidence rate of acute myocarditis is quite low, but similar results, a higher incidence rate among male patients and younger patients compared to female patients, and also we see a high incidence rate of the second dose compared to the first dose. So to come to a conclusion, acute myocarditis after mRNA vaccination is a very rare event with a very low incidence rate. However, male patients and young patients seem to have a little higher risk. Fortunately, the clinical course is mild in most cases. And most importantly, healthcare providers and authorities should keep encouraging the public for vaccination. Thank you very much.
Thank you. Thank you very much. Any question? Because I have a question for you. Did you do an echocardiography to follow up the development or no of left ventricular dysfunction?
We did before the MRI actually in transthoracic echocardiogram, and it showed a normal left ventricular ejection fraction, no clear signs of regional wall motion abnormalities. And so we proceeded with the cardiac MRI to further assess the left ventricular ejection fraction and to analyze the myocardium itself to check for the typical pattern of myocarditis. Yeah.
Okay, and another thing, I think that the study of New England has a limit that they haven't a comparatory simultaneous group. So I think no consideration between the causality between the incidence of myocarditis and vaccine. What do you think about? They haven't two groups, a comparatory groups without no vaccine and a group with vaccine. So I think that they couldn't do a consideration because it's a retrospective study and they didn't search for criteria of myocarditis and also for the causality of vaccine and the development of myocarditis, I think. But
I believe it's true. It's just observational from a big data set, but there's no causality probably. But I think approximately 1 month prior, there was data published also in the New England Journal of Medicine. And in this study, they compared the incidence of patients receiving a vaccine compared to the incidence of patients actually having COVID. And they compared between these two groups the incident rate of myocarditis. And in this study, it was shown that patients who actually have COVID-19 have a much higher risk of acute myocarditis compared to patients receiving the vaccine, which I believe is a strong indicator to encourage people to go on with the vaccination because the risk of myocarditis is much higher if they contract the virus compared to if they get the vaccine. This is an important message that should be the message of this talk.
Okay, thank you very much. Any question? Microphone, please.
Yeah. That was a really nice presentation, an interesting case and challenging clinically. Did you discuss with the patient whether you thought it was a causal event? I'd be interested in that. And then secondly, just to speculate, there isn't a right answer, but what do you think the likely mechanism is related to the mRNA vaccine? And why do you think the preponderance of men, which was very striking in that paper that you showed?
Very interesting questions. Maybe to the first point, I think when we discuss this potential link between myocarditis and the vaccines, we have to be very careful not to discourage the public and to not spark fear. We know that if you look at the numbers of people that received the vaccine in Austria, were around 65% of the overall population received the vaccine. There's a big part of the population that is afraid of the vaccine and doesn't want to get the vaccine. So we have to, I believe, be careful when we discuss this with the patient and keep encouraging to get the vaccine. And to the second point, this is a quite complex and interesting question. I believe it's not yet fully clarified. I believe potentially the mRNA, before it reaches the target cell, might be immunogenic itself and trigger a pro-inflammatory cascade, which might involve autoantibodies that target the cardiac myocytes. But I'm sorry that I don't have a clear answer to this question. Also, it's very interesting why male patients seem to have a relatively much higher risk compared to female patients. I don't have a clear answer to this question.
Okay, last question.
Hello, just a curiosity. Did you find any findings about autoimmunity disease, any labs about this? Because myocarditis in a very young person, excluding the infection.
We did check this, and we have a standard panel to check for autoimmune disease, but it all came negative. So we think might be there's association with the vaccine, yes.
Okay, thank you very much.
Thank you.
And